insurance coverage is maximum possible as possible as and then today we also have agenda points of sensitization of our sector. For example, there are great developments in last 2 years. One of the development is that we have Dr. Raghu sitting here. He is representing Ministry of Ayush at DGHS. So DGHS, there is a separate vertical of Ayush, and he is heading that vertical as Deputy Director General Ayush at DGHS, Director of Health Services at Ministry of Health and Family Welfare. This is a great example of convergence of both the ministry and how we are working together as a whole of the government approach at Government of India. And the DGHS Ayush has started activity of standardizing, publishing standard treatment guidelines. It do not mean that they will start SDGs not available. SDGs were already available, and there are a lot of work already have been done by the sector in last 2 years and by government. But what they are doing is very specific, very interesting. That 3 weeks back they have released the musculoskeletal disorders SDG, and this SDG is actually reviewed by the modern medicine experts also, and not only Ayurveda experts, not only Siddha experts, because SDGs are now they released this musculoskeletal about Ayurveda, Unani and Siddha. So, and it is reviewed by the modern medicine experts, the professors of orthopedics in different medical colleges. This is first time happening in India that this integrative model of standard treatment guidelines is now being standardized and being published. So there are already standard SDGs available, published by CCRAS, CCRH, CCRS, CCRUM, and those are already in public domain. There is another development that I would like to address the entire sector. The Government of India has worked with WHO, and on WHO platform, WHO has published the treatment and training documents of Ayurveda, Siddha and Unani. And yoga is now being published, and Ayurveda, Siddha, Ayurveda, Unani, Panchakarma and Yoga. Now Siddha is being worked out. We have recently signed MOU with them for Siddha, and homeopathy is also in the pipeline. So what I am trying to convey that not only in our country but globally also, the benchmark documents are being prepared and familiarized, and member countries are sensitized by WHO about these documents. And these documents are very valuable documents for the insurance companies to curate their packages and standardize their packages. It is easier when we have good documentation practices. It is easier for the insurance companies also to visualize and to visualize how to prevent fraud and how to make it scientifically validated. That all of us know. But Government of India is sincerely working in this direction. For example, not only SDGs, not only WHO